I've gone in to see the ophthalmologist, and I've been a glaucoma risk for quite some time. They always check my blood pressure when I go, and I scared my eye doctor.
Well, it started at the ER. My blood sugars were over 500, which is very high. They let me know then that I was diabetic and that I needed to make changes.
When I first got the call and they told me I had diabetes, I was like, oh great, this is the end of eating anything good ever again.
I wasn't very successful at first. I was more in denial, I guess, of having the disease.
All of the resources that I need to take the best care of my patients as I possibly can are all under one roof.
We work along with the physicians and the staff and the clinics and help coordinate the care of the patients, education, follow-up, preventative measures with our patients.
Social work, diabetes educator, therapy. We have pharmacists here. We have the nurses here. We have nurse case managers here. So rather than, sending out messages or just telling the patient, go find a therapist or go find a diabetes educator, they're located here and here, they can just come in and see the patient that day. So it's much more coordinated and much easier for the patient, I think, to access care and get the care that they need.
It's more of a team approach. It's usually, led by the physicians with coordination of the receptionists, the clinic staff, medical assistants, health coaches, and the physicians. And we hope to manage the patient's care the most so they can have the most healthy outcomes that they can have.
Taking care of diabetes is so much more than just take these medicines, see you in 3 months. It's also, why can't you take your medicines? Are you affording them? Do you need to visit with a social worker to help you afford your medicines? Is there a reason you're not taking your insulin? Are you afraid of the needle? Then we can have you speak with a diabetes educator and we can come up with another way to help you overcome those barriers.
13 years ago, I was an intravenous drug user, and I've overcome that. But becoming a diabetic, I had to use needles again. And it was very hard for me to not relate the two together. So the clinic has made it possible for me to get free insulin through the shared care. And I get pins where I can just dial it up and use it. And so that way I don't get those desires or wants or things that come with addiction as well. So I just thought it was really special for them to have that concern for me.
It's definitely different than what I anticipated. It's much more, I guess it's more personal and more, more kind of hands-on, like there's somebody there to be accountable to. Just working with Lisa and like that has just been huge in understanding what diabetes is and how to control it.
We do them only for diabetes patients, type 2 diabetes. There's about 5 to 6 patients with diabetes that come to each visit. So rather than just one-on-one patient provider or patient physician, it's 5 or 6 patients all with diabetes with the resident physician. But it's not only with the resident physician, it's also with the social worker, the pharmacist, the diabetes educator, the nurse, and the therapist, all there at the same time.
I met other women my age, around my age, that have been through the same struggles that I have. We have amazing classes on how to prepare food, things that we go through, and we really became a bonded group of women that encourage each other to do the right thing. We get our blood tested. We talk about the different things that we've done in the last 3 months to help or not help, and ways that we give each other encouraging words as far as ways to eat different or find different ways to exercise, things like that, portion controls. It's something to look forward to because that's when we get to see each other, and it's a good time for success stories or failures or I need help with this, or, we come together as a group and it's like we're family now.
So we did focus groups with the patients in the group visits to find out what they liked most about the visits. And I would say far and away the biggest thing that they enjoyed about the visits was that sense of peer support, so that they weren't alone in their disease and there were others who were struggling as well. So just that sense of peer support. One patient actually said, it's like AA for diabetes.
I think that they're more, their numbers are better in their diabetic control. Their A1Cs are better, they have less hospitalizations, they're more apt to follow up with the physicians on their routine visits, whether it's 3 months or 6 months. They understand their medications more. They know if they start having lows, they can always call us and we can back off stuff. They know whether to call if their sugars are starting to get high, and I think they're more comfortable with calling us versus just coming in every 3 to 6 months.
I came off the diabetes medication in May, and that's now just controlled with diet and exercise. December I started walking and have since then moved into running. Discovered that I enjoy running. So I'm going to do a 10K in 2 weeks that I'm getting ready for. That will be my second 10K. From December, I'm down 97 pounds.
But today I'm pretty well. I take my insulin on time. I try to watch what I eat. My A1C was 12 and now it's down to 6.1, which is real close to a normal AC1, which is 5 to 6. And I've lost 40 pounds in the process. This care differs because it's personal. I mean, I know when I walk in the door, they know who I am. It's always a smiling face. How you doing? I feel like I'm at home and that I'm with family and that I don't have to lie or cheat myself for their benefit. And I know that in the past I've done that at different doctors and stuff when I didn't have the relationship that I have with the group here.